now in a story that we brought you last month that had hundreds of you reaching out to us. Dr. Abhinav Singh is a well-respected Indiana doctor fighting for permanent residency in the United States. He's been trying for 18 years. We talked to him, shared his story. It's pretty amazing. He's one of thousands of U.S. trained physicians right now calling on lawmakers like Indiana Senator Todd Young for help. Senator Young joining us now live from D.C. this morning to talk about how he got involved. Senator, good morning to you.
Good morning. Thanks for having me this morning.
Absolutely. When we had this story on, I mean, just hundreds of people reaching out saying, what is going on? Why so long? Dr. Singh praised you on this show for taking up the fight. Why are thousands of healthcare workers like this still in limbo, though, so many years later?
Well, the truth is, Angela, they shouldn't be. So thank you for shining a light on this issue. And I praise Dr. Singh and others for their vocal efforts. Our national immigration laws put a cap on the number of visas that are allowed for highly skilled individuals, even from various countries around the world. Those caps disproportionately impact people like Dr. Singh, who originally hail from large population countries, even if they're highly skilled. And even if they have the exact skill sets needed by our workforce. We're in the middle of a pandemic. Of course, the skill sets that are often most needed in our local communities are nurses and doctors. So what our legislation does is it makes sure we take existing visas that aren't being utilized, 40,000 of them, and allows people like Dr. Singh to utilize them for emergency pandemic purposes.
Yeah, and he's saying, you know, if this doesn't get passed, do you have something that you've been working on called, I believe, the Healthcare Workers Resilience Act? If something were to happen to him, his family could be deported. Where does this stand? And is there any chance of it becoming any kind of a law anytime soon that would allow him to have permanent residency?
Well, right now, we're hoping that this becomes part of the next COVID relief bill, which I hope passes before year's end. We're back in Washington. Most of the elections are past us, aside from a couple of special elections in Georgia. Myself, Senator David Perdue of Georgia, and others are fighting very hard to get this included in the next coronavirus relief bill because, you know, frankly, we're hearing from not just Hoosiers, but people around the country that their local communities, their hospitals, their medical clinics are understaffed, they're overwhelmed, their healthcare staff is exhausted, and they can't serve all the individuals that are coming in some instances. So there's a real imperative for us to act at the federal level.
And I want to talk about, I mean, obviously there are people that maybe don't support this or they have a concern. Can you talk a little bit about, is there anything negative about this or why, I guess when I first put this out there, you know, I was getting then reaction from people saying, well, it's this senator that won't support it, Angela. Ask this particular person why they won't. What do you have to say, though, to those that say there is a holdup here and maybe somebody's mind needs to be changed?
Well, oftentimes, whenever you try and tackle immigration issues, and this is a sort of immigration issues, it comes with a bag of misimpressions and misunderstandings. There's sometimes a misimpression that legislation like this will excuse me, displace American workers, American professionals. We have explicitly indicated in this legislation that a healthcare facility needs to certify that there's no displacement occurring. Moreover, it's pretty evident from Department of Labor data that there's a massive healthcare workforce shortage right now. That includes doctors, nurses, mental health professionals, and others.
Yeah, and just because you cleared your throat, I wasn't necessarily going to ask you about this, but are you all better now from your COVID diagnosis?
I am. I don't believe that's a symptom.
Okay.
But yes, I'm doing great. I sheltered in place as we're supposed to for a number of days. 2 clear tests and doctor sign off, and I'm back to work.
Excellent. Well, we hope that, you know, just getting to know Dr. Singh, he's obviously helped a lot of people. We actually had a viewer of ours that was the one that said, Angela, will you please look at his story and share this and ask you what is being done about it? So we appreciate your time this morning.
Well, Angela, thank you. I, of course, appreciate all our healthcare providers out there. And I have to say, our journalists who are shining a light on these issues right now, you're doing a real public service. So thank you.
Senator Young, thank you so much. Have a great day there live in D.C. this morning. It's 8:48.